So we're going to do the NUR203 pediatric review for exam one. So I changed the PowerPoint a little bit, but I'm going to send it to you. I added something because I felt it was needed when I went through and looked at exams and making exams, etc. So that is there for you. And I will be, getting that to you. I just did it, so it'd be nice and good. So you have to be quiet now as I do it, okay? So it is a lot of chapters, and it can be very daunting. It is chapters 26 through 35. This is all your age group. So let's figure out what the important stuff here is. Well, one of the things in this exam, you're going to see a few questions on the theorists. There's four of them that you do have to know. We know that there's Erikson, there's Freud, there is Piaget, and then of course we have our good old, morality and Kohlberg, okay? Four of them. As I go through this, try to listen to the way I relate it and make sense of it because the exam is pretty heavy on theorists and understanding why they're important, okay? So let's look at Erikson. Erikson is the most tested of all of the theorists. He talks about how the child reacts to people, surroundings. How does he react around there? How does he understand and the right, the wrong, and relating with people and friends and family and et cetera, et cetera. So it starts out with birth. At birth, what does an infant do? He only sucks, swallows, and breathes, which means he wants to eat, he poops, he sleeps, he burps. That's it. Those are his needs. So, what is this sense of trust and security? Well, when an infant cries, what happens? Usually, somebody goes, picks him up, burps him, feeds him, changes, whatever. I trust everything's going to be great. Well, there are some home environments, and it could be there's drug abuse, alcohol abuse, or just regular old physical abuse. And those parents or caregivers sometimes neglect to go and pick up that child right away or let them crying for a while. They don't hear them, whatever. What that does, it leads to a sense of mistrust. That child actually, after a while, stops even crying because nobody's going to come. They become more apathetic, like almost like a blank child with not any really personality. The child who is trusting is happy and healthy and smiley, and it's a different baby. As we get older, we go into your toddlers. Now, what do you know about toddlers? What have you been taught? These are all about me, mine, mine, I don't share. I'm a picky eater. That's a toddler, right? So, what does Erikson say about how this toddler relates to other people? You don't share, and he wants to go and look. It's this intense exploration, looking at his environment, going underneath things, around things, pulling things. I mean, this is why we have to be careful of safety with these children because of their exploration. Now, this, you have to be quiet. This sense of being able to go and explore and have that ability by himself gives them that sense of autonomy. Autonomy, automatically mine, me, I want to do. And that shame and a doubt is don't tell me how to do it. Don't try to protect me. Don't be the helicopter mom behind them because they're going to fall. They're going to, bump their head. They're going to scratch their knee. And parents want to protect the child. But what that does is it stops the child from exploring and it becomes frustrated. It gives them shame and doubt. Like, why can't I do that? Right? They need to try. That's how they learn. You don't do anything without trying to do it. Now, preschoolers are more about trying to make decisions and doing things. It could mean that they'll take their laundry and put it in the basket, but what if they put it in the dirty clothes hamper, not the clean clothes hamper? They put them in the wrong places, and now that's the guilt. I did it wrong. I tried. I had the initiative, but I didn't do it right. So now I'm guilty. Because kids, they don't do everything right the first time. You got to try a couple times to get it right. Now, industry versus inferiority and trust. These are your two biggest, and identity. Those are your three big ones that I've seen even on your HESI and your NCLEXs. Now, school age children, this is the age where they have all those weird words. Industry, what does that mean? So let me explain what an industry is. This is how they react to people around them, Erickson, right? The industry is what? Industry is their factory, it's their product, it's what they do well. It could be they run the fastest, could be that they are good at math, it could be they're the best writers, or whatever they do really good gives them a sense of pride and accomplishment. And it makes them feel good about themselves, right? Because people are telling them, wow, I don't believe you run that fast. Or I didn't know you could do that with your math. That's on an eighth grade level. It's amazing. That feels good, right? So, what's the inferiority? Well, you can't do everything well. So, that's the inferiority part. I can run fast, but I'm horrible at math. I'm great at math, but I can't run. I mean, it's all these things. Good at something, my industry, my factory. What do I do well? And the inferiority is I just can't do that. And I wish I could. I want to do everything well. As we get older and we get into the adolescence, this is that intense time of who am I? What do I want to be? Who am I going to hang out with? I'm so confused. I hate my body. It's going through all of these changes. I've got freckles. I'm too fat. I'm too skinny. My hair's too short, too curly, too red, too blonde, too whatever. Identity. I don't know who I am. I don't know if I want to be a doctor or if I want to be a secretary or I want to be a, they don't know. And it's a feeling of overwhelming role confusion. That's why it's the confusion. And the identity is the body image, finding out who they are, what their body is, and getting used to it, and then what they're going to be. Do they hang out with the band group? Do they hang out with the art group, the sports group, or who? That's their identity. Okay. Does that make a little sense more to you, the way that's explained? Now,
Definitely. Thank you.
you're very welcome. It took me a few years to figure out how to explain it that it's understood. Now, Freud, anything about sex? Anything. Infants, how do they explore the world? How do they soothe themselves? Health. What's the best way that you can even do painful procedures on an infant and they soothe themselves? Sugar water and a pacifier. Num, num, num. It's like giving morphine. There is an article that I did during my PhD dissertation that talked about a Harvard neurophysiologist or whatever they were. And they talked about giving morphine or sapphire with sugar water for circumcisions in the male. And there was no difference. Morphine, sugar water, it's self soothing. As soon as the circumcision was done and they unstrapped the child, they're not crying anymore because that sugar water is all they needed. So that's oral. Anal. What do children do at ages 2 to 3? They potty train. Why anal? Bowels are trained before urine. So anal bowels, toddlers, perfect. Then we go up to phallic. This is your preschoolers. This is more about girls like their daddies and boys like their mommies. And they're actually starting to understand there's differences with boys and girls. Again, this is the end after potty training. They're starting to know that. And then again, schooling. And this weird word, right? Latency. I mean, what do we do with that one? Well, latency, and if we know it's Freud and we're thinking sex, latency is school age. Now they've got friends, but they're same sex peers. They usually don't boy to girl, girl to boy. Usually girls hang out with girls and boys hang out with boys. That's a usual school age. And that's what is considered latency. And then, of course, what happens when they become adolescents? All of a sudden, it's the genital stage of thinking with that, not their heads right now, because they're exploring their hormones, they're going through puberty, it's completed, and it starts that. So that's Freud. Now, Kohlberg. No, you don't have to know those names. They're weird names. Let me explain what this means. Goldberg is all about knowing what right is right, and when wrong is wrong, and when you should do either or, right? Now, when you're an infant, you don't understand that. Toddlers, they don't understand that yet because remember, me, mine, mine, I don't care. I'm going to do what I want anyway, right? Automatically, me, mine, I don't care. Preschoolers. Preschoolers are now understanding if I do something good, I'm going to be rewarded, whether good words or maybe a popsicle or a cookie, right? And when I do something bad, ooh, something's going to happen. I'm going to have a privilege taken away. I'm going to go to my room, or I can't go to my friend's house, or what, right? Reward and punishment. As Kohlberg gets older in the morality and what he describes is when they become school age children, it's only that children do things to please adults. They want to conform, be loyal, and do the right thing. Basically, that's what that says. Okay. As they get to be adolescents, there's rules of society, what you do, it's just as simple as stopping at a red light. That's a rule of society, right? Or holding doors open, or just general, moral principles, etc. That is adolescence. And they already know that. That's just a part of it. Now, I do mention Fowler's only because, religion is something that you will see. You have some of your children, families practice a religion, and you need to give that family the ability to practice whatever their faith is. Now, do you have to believe in what they believe in? Do you have to agree? Oh, no, absolutely not. You start with any with religion, know your own beliefs. That's what you need to know, and give that client, that family, the ability to practice their religion as long as it doesn't interfere with your medical care. That's why this one's here, not necessarily the name, but the concept of religion. Now, Piaget. What does Piaget talk about? Thinking. Think about an infant, and remember, I just had a brand new newborn baby born at 1:20 on Friday morning, Good Friday, little Benjamin. So now we're going to hear about him now. Benjamin, when he came out, did not know how to breathe. He didn't know how to suck. He didn't know how to swallow. And to put all three together, that was a brand new learning experience. Did he do that inside mommy? No. So he comes out first thing, hit him, cries. I can breathe. All right, put something in the mouth. All right, let me say, oh, I can. Oh, it tastes good. And then they learn how to suck, swallow, and breathe. Think about the fine motor skills. They don't know they have hands at first, right? What's the first fine motor skill? Mommy puts the finger in the isolette, and I did this to his father. I said, put your finger next to his hand. And he grabbed it. He goes, oh, look, he's hugging me. And I just giggled because I knew it would be a reflex. Now, he's learned now how to do it by a reflex. Now he can do that. He can hug that again. So you can see Piaget is about the mind and then how it gets more and more involved, right? So at birth, now we're grabbing the rattle. Ooh, it made a noise. Now I'm shaking the rattle. Ooh, it got in the mouth. Ooh, I like that. These primary circular, secondary circular, tertiary, basically it's talking about how they're taking simple things and making them and creative and working, thinking about it. As simple as putting hands out. Now I'm an airplane, vroom, vroom, right? Getting on a broom, riding it like a horsey. Imagination, thinking. Now, the two types of things that are always confused with Piaget It's really not the beginning steps of PHA. Excuse me, my voice has wanted to go since yesterday. I apologize. Concrete operational. Another school age, right? What's concrete? You can see it, touch it, feel it, smell it. If you've seen it, touched it, felt it, smelt it before, you can replicate that. You can do it again. If you saw somebody do something, you've seen it, you've touched it, you felt it, you can replicate. That's concrete operational. They not yet can think their way critically to get where they need if they haven't seen it before. Formal. This is the good old adolescence. Adolescents can change mommy and daddy's mind about grounding if they're good at it, right? You're not going out Friday night. Oh, but oh my God, it's my girlfriend's birthday. There's a party. Don't care. You did. What is that adolescent going to do? Write his way out of a paper bag, right? He is going to do, or she, everything they can do to change their mind. Do the dishes,
You have
clean
to get
the
them in a
room,
good mood. You have to get them in a good mood.
all of that. And then do all those little things that oh, okay, you've been really good. But then you bring home like an A on a test or something. This is formal operation. They had to figure out by themselves, without seeing it before, how to get what they wanted or how to do or whatever it is. It's something they've never seen before. Concrete, I touched it, I saw it. Formal, I have to figure it out. And that's adolescence. I put in a bunch of little things here to show you the difference. I'm not going to go into all of them. I've basically explained it to you, but it shows you the name so that you can see it, okay? Now, play. Play is what children do from the moment they wake up to the moment they go to sleep. And if I were to give this phone to this kid 24 hours a day, he'd be playing games 24 hours a day. If it's not that, he's going to be here, there, whatever, playing toys, games, coloring, whatever, the time. Now, in children, we do describe that. Onlooker play is when you're looking at somebody and you're just watching. That's it. You're not involved. Solitary, you're playing by yourself. Parallel play is toddlers. Parallel is next to each other, and you're not sharing. Remember, who are toddlers? Me, mine, don't touch it, or they'll rip it out of your hand. I'm not sharing. That's a toddler. It's normal behavior. So remember, toddlers, parallel. Associative play is two or more children playing together, all with the same toys, but they're not creating anything. They're not, somebody wins, there's not a goal, but they're having fun. Preschoolers, associative. When we get to cooperative play, this is two or more children playing together and they create something, a racetrack, a castle, playing checkers, winning the game. Somebody wins, there's a goal in the end. So, parallel, toddler, associative, preschool, cooperative is school age. There's a goal in the end. Now, culture. I mean, I got hit with culture like crazy when I moved from a little tiny little town in New York where there was no culture to Miami. And then I married a Cuban man and had children. And I divorced that one and I have a Jamaican man. And we've been together happily for 20 some odd years. Talk about cultural differences, religious, the way you do things. Trying to keep up with it is extremely difficult. So, me, as this person who didn't really know culture, as a young nurse, I came to Miami. What did I do? I would ask. Parents and children would prefer that you ask what the differences are. Do they need time for prayer? Do you have a different diet? There's cultures that do not want males taking care of their daughters. Um, all of these things are important parts of your care plan. Okay. So again, cultural differences, they're gonna be, it's okay. Again, you don't have to believe in their culture, their religious anything. You have to know who you are. but give them the opportunity, because I know when I pray, I feel better. And maybe they do something that makes them feel better. Give them that. They need that in their minds to feel good. Now, assessments on children versus adults, completely different. So, first of all, remember when you approach a child, get down below them, not towering, open up the conversation on their developmental level, and then talk to them. You can use dolls, you can use papers, toys, whatever, in order to explain it to them, okay? And they do really well, but you can't just walk in and just think they're going to sit and listen. You've got to go through that process, building that trust. Now, if you walk in a room and you have a child, especially babies, and they're asleep, this is the best, probably the best time to listen to heart and breath sounds, because when they're awake, they're always moving and making noises and right. So, can you really hear heart sounds? Can you hear breath sounds? Very important concept there, because heart and breath sounds are extremely important. Another thing with doing these assessments, the last thing I'm going to do is a blood pressure. Why? Because it hurts. I don't care where you do it, it hurts. I don't like it. Kids are afraid of it. I have to make it in a game about them pushing the button and guessing numbers, and it does help. But again, from least to most invasive. Another thing is we're doing assessments, listening to what they're telling you. I worked in the emergency room the last 10 years of my career, trauma ER, very, 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 very busy. And we would do our assessments. And if you're hearing something from a child and a parent, and their stories are just not matching, always think of protecting the child. Now, I had several cases of child abuse that I've worked with. One was withholding food. One was physical injury, broken scalp, femur bones, rib bones, humeruses. One kid, a baby. So if we see anything that we suspect, remember, report it to the charge nurse, report it to the doctor. Probably DCF will come. Your job as a professional is to keep your children safe, right? So whatever you have to do, do that. Always think of that. Another thing is that you have a child coming in, parent brings them in that their son or daughter was sexually assaulted. And yes, it can be males or females. Remember that parent's going through a lot right now. Can you imagine having to bring your daughter in that was sexually abused, and you have to talk about it and live it with your child? And it's not, it's really hard. Number one, to bring them in, but to live it. So remember, they need those hugs too. They need that understanding. Now, there's something else that's abuse, and it's called Munchausen syndrome. Munchausen syndrome, I've seen like two cases in my career. It's not that um, familiar, popular, or it's not one of those things you see a lot. But remember, Munchausen is a parent, guardian, caregiver that likes to keep their kids sick. So what do? They take things like taking syringes, putting it in the toilet, taking it up, squirting in IVs, taking dirt, whatever, putting it in sores and wounds, and food with chemicals in it, all sorts of craziness. I don't even know what all it could all be. But what is our position as a professional? If we suspect Munchausen, you need to, whenever that mother comes in, or father, or caregiver, whoever, somebody in the room with that child, with that person. If they bring anything in, you need to inspect it. Now, they don't need a caregiver at all side, a bedside. When that person or suspected person comes in, that's when they need to be at the bedside, making sure that, again, keeping the child safe. Growth. What do you think about growth? Nutrition, nutrition, nutrition. If you don't feed, they're not going to grow. If you don't feed, their brains don't get the fuel, their minds are not going to grow. So the most important, single most important influence on healthy growth and development is nutrition, nutrition, nutrition. Now, one of the things that I say is every visit, what do we do to a child? Guaranteed, a height and a weight. Do we do that on adults? No. I don't even know the last time somebody weighed me. I've been lying really good for a long time. I'm always 20 pounds less than what I should be, right? 'Cause I'm a bit of a big girl, so I only weigh 200 pounds. I don't weigh 200 pounds, right? But children, why do we weigh them? What's the importance? Well, I mean, infants double their weight at 6 months, triple it at 1 year. If they don't, we know that they're not getting nutrition, their minds, their body's not getting what they want. We need to address it quickly. Too much, too little, right? They're too heavy, we can cut down. Too little, we can increase. Also, what does this weight also can tell? It can tell us about growth hormones, thyroid hormones, all of these things that could be out of whack just by measuring height and weight every visit. Now, one of the things that we see, especially with older children, is especially today, is the influx of obesity today. I mean, it's an epidemic proportions because of many, many different things, and that's part of this week's lecture about it. Um, Children that have a problem with their weight, too little or too much, how do you figure out what you need to do? Well, you start out with what they're eating. Always think when you think of diet, you think of overweight, underweight. What is your treatment? Number one, a diary. Find out what their food diary is. What did they eat yesterday? That's a good start. Or keeping a list for a week. Always think diary when it's a problem with weight. So, adolescents, we do the BMI. Now, 95% is obese. 85% is you're considered overweight. 10% apparently makes a difference, but knowing that 95% is the one that is considered overweight. And again, food diaries do help you. Now, am I going to have you do a question that to ask you how to figure out a BMI? No. Do you need to know that it can be done, that can help you looking at nutrition and body mass? Yes. But to do it, no. Now, developmental assessments. This is all part of weighing them, seeing how high, how tall they are, how much they weigh, see if they're within the boundaries. We're also doing developmental assessments. Are they lifting their head up by 3 months? Are they rolling over by 5 months, 6 months completely? On their knees, when are they using their fingers, voluntary or a reflex grasp? All of these things, if they're delayed, we can institute early intervention. You know, the beauty about children, if when we recognize these things going on and they're not where they should be, one of the biggest things I've always heard questions asked, child 7 months old is having a head lag, what would you do? Well, number one, what's a head lag? When you pick up their arms off their back, their head falls back. It doesn't come up with the child. That's a head lag. By 3 months old, it should come up. 7 months, they're not. What do? Well, you tell the doctor, and they'll rule out any sort of, physical reasons why. And then we'll put them in early intervention. There's all sorts of programs. Every state all have programs. They really focus on special needs children's and their needs and programs, etc. Now, I put in here this cardiac assessment where heart valves are. It's actually going to be a refresh for you because next month in capstone, next quarter, you're going to have to know where these things are and say it in your final simulation. So again, this is where the children's ones are and where you would hear murmurs, etc. One of the things about children is their chests are so small, their hearts are so big, it's really hard to place it exactly because sometimes you can hear murmurs all over the chest and you don't know exactly where it's at. Now, these are where you would hear them, just to give you the idea. But again, when we're looking at heart rates, an infant, you were told neonates, normal heart rate, 140 to 160. beats per minute, right? Respiratory rate 40 to 60 breaths per minute. Now, an infant is up to 1 year old. It is also the heart rate starts coming down, and you might see a normal 110. So 110 to 160 is a normal heart rate for an infant, first year of life. Okay. And again, that good old heart rate when a baby is sleeping is the best thing, and it's the fourth intercostal space on the left side of the chest. And always you listen for 1 full minute. Now, breath sounds. Breath sounds in children, again, can be tricky also. And the reason is they have all this upper mucus in their nose and their throat. They can't blow their nose, and they can't spit it out or cough effectively. So we hear a lot of referred breath sounds. Now, when we do tracheal, bronchial sounds, you're hearing a lot of upper airway. And that's what this is trying to tell you here. Depending on where you put your stethoscope, depending on where you're going to hear these sounds. Car seats. Do you know, I remember that little metal car seat, and it was my brother, and it was in the front seat, and I sat next to him. And all my mother, my father, my brother, and me all were in the front seat of the car when I was a kid. So can you see how things have changed? It's quite drastic, how well we're protecting the children. Now, what do you need to know about car seats? Very important concept. You need to be in the back seat, rear facing, till 2 years old, or until they reach that height and weight restriction. Now, another thing with the car seats is they have these harnesses. Make sure they're snugly, they're snug and they're holding that child in. Another thing, especially little the little Benjamin, who was 6 pounds, 1 ounce by the time he got home, roll up with blankets, snuggle around them, and hold them in really position because they'll flop around. So you can use baby blankets, snug them in really good, and rear facing, and they actually stay in the center of the back seat. How many of you put it behind the passenger seat? Because I could see it driving. Yep, me too. And remember, car seats do expire. So let's go into all of the infants. These are all of these little developmental things that you need to know. And if you don't need it, know for this exam, guaranteed SC NCLEX, these are what they like. Those are the key things that you should understand or try to figure out. Now, head lag is when you're pulled up, their head goes back. Head lag should go away. They should have head control by 3 months. Please place all your babies on their back to go to sleep. It's also called supine. Um, when I first started in the hospital where I ended up leaving after 25 years, when I first got there, they were doing this study on back to sleep, which is, this program. And they used to put them on the back and on their side. Well, they don't do the side anymore. You know why? Because they're still breathing their CO2 and their faces could fall in the vomit and they could aspirate it. So now it's only on their back. Again, another change in practice by research, which shows you on their back, you have less SIDS death. Now, rolling over front to back or abdomen to back to abdomen is tricky. At 5 months, you can be on your bellies and they sort of drop their head and they roll over. They don't do from their back to their abdomen till 6 months. So a complete rollover is at 6 months, which means at 6 months, you better be very careful putting that child on any surface that if they're not strapped in, they will roll off now. One of my kids did it, my first one. When they're on their back, they start putting their feet in their mouth and sucking on them. They're going to grasp objects. It's going to be that voluntary. About 3 months, again, everything in their mouth because that's what they're exploring. They say the first tooth is about 6 months of age. So if it gets 8 months, -6, it'd be about 2 teeth they should have. They should go up to standing position about 9 months. And then the big one, sitting unsupported 8 months. They should be able to sit there, no pillows, nothing propping them. And then by 12 months, they should either be walking or attempting to walk. I've always said my kids never walked at 12 months. At 15 months, they ran. They never took a step. Took 28 the first time. And I call that running. And as long as they're going forward, you're okay. Now, colic is a lot of gas. And as a child with colic, it's exhausting. The one thing, this colic will go away most of the time by 3 or 4 months old. By that time, mommy, daddy are exhausted. This child is going to be crying, 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 crying. Now, if you're in a doctor's office or ER, or you're getting a phone call regarding, and they're telling you that this child is crying all the time, do not assume that it's colic. It could be something else. Any young infant, remember, they're immunosuppressed, they are apt to get sickness. Is less than 6 weeks old is like the critical time. If they're crying and they're that sort of age, they need to come in. Let the doctor look at them and say, yes, it is colic. Better safe than it is to be sorry. And colic can be treated many different ways. It could be how they feed them. They might have to put that little gas drops in them or something. All different things can be done to try to help. I know I had a friend who used to take her son, put it in a car seat, and go out for a car ride. It's the only thing that calmed him down. 3 o'clock in the morning, baby's crying, colic. I can't handle it. I'm going for a ride. I said, okay. So, infants, there's these different sort of trends and stages, okay? Just words, definitions for you. Sequential trend, it just means everything happens in a sequence. We do a reflex palmar grasp, then we do voluntary, then we do crude pincer, fine pincer. I mean, goes up through certain steps. It's you lift your head, you go from front to back to front, on your knees, and then you sit, and then you start standing, crawling, walking, right? These are all sorts of ways that they work. Now, developmental pace is the way the kid works. Not every child goes through all the stages, but they go forward. They go from lifting their head to walking in some fashion. They may miss some stages, but that's absolutely okay. And then the sensitive period are limited. There's very small times, but at times they're learning big things in language and movement, and that happens several times during their lives. Now, soft spots, those little soft spots on their scalp. Important thing to remember. The one in the back of their head is called posterior. It's usually gone within 2 to 4 months. So what if it's not there after a month? It's a problem because your head's growing. So it would be reported. What if it was 6 months and it's still open? You need to report it because it's not normal. It could be hydrocephalus, could be brain tumor, could be something. It should close by that. And then also the anterior, that nice little soft spot right here. The one I love to look at to see if they're dehydrated. What's their nutrition status? I can tell, their fluid balance just by that little fontanelle up there. It usually closes between 12 to 18 months. Now, if it's 20 months, it's okay. If it's just a little open, but if it's 20 months and it's still open big, again, report it. There's a problem. This is the reason why we do head circumferences when we have visits on infants, right? Monitoring that fluid in their brains, making sure fontanelles are closing. Another thing kids do is they have when they're at birth, number one, they see black and white. They don't really focus. This eye works separate from this eye. They both work separately and they look cross-eyed all the time, right? It's what we call binocularity. Usually about 12 months, they work together. what? Why do I mention it? Well, when the eyes don't work together, you don't have good depth perception because you need them together to be able to do that depth perception. And that's what that means. Pain in children. Do you remember which scale are you going to use? So, pain in infants. What are you going to see? Well, they're going to cry. You're going to see the crumpled head. Your little chin's going to be quivering. Those eyes close, and you just know their arms are moving, and you can hear that little whimper. You know something's going on. If they're like banging their head, you know they have a headache or maybe it's an ear problem. They put their hands down their mouth, it's sore throat, right? They're telling you where's the location of this pain. So, in pain, make sure you evaluate it and make sure you give doses when you're supposed to, and be consistent with it. If you give one dose and don't follow it up, it's not going to relieve the pain. You need constant monitoring, and if they need something, to give it when they need it with good evaluation. Did it work? Do I need to give something else? Now, the other thing with infants, like I said, a little pacifier, a little sugar on it, or oral sucrose, it takes care of so much pain so well. It could be a heat pack, a hot pack. It could be music or giving older kids, you can distract them with many different things. But infant, good old pacifier. Now, SIDS death. Let me tell you, the rates of SIDS death have gone way down drastically since every single hospital have children, babies delivered, they all have a program about back to sleep. My daughter just got this little Snuggie packet. Of course, it has the hospital's name on it to hold them flat on their back when they're sleeping, which I thought was pretty neat that they're giving those away. So SIDS death. Children who are not sleeping on their backs, they are on their tummies or on their sides. If the mattress is too soft, they sink in. Blankets, they bumper pads, they get in their face and they suffocate. Oh, they used to have such beautiful bumper pads when my kids were little, and they used to put all of these little animals, and you can't do that anymore. Bed sharing. I've actually seen a newborn was in bed with the parents, and the father was a little large, and he rolled over at night onto the baby, and the baby came in not alive. So it does happen. I've seen it. So you shouldn't share beds with a baby. Another thing is overheating. Parents think that you have to put an extra, clothes on these children. If you're comfortable, the baby's comfortable with maybe one more item on. You don't have to go crazy with the amount of clothes on them because overheating can cause SIDS death. Smoke, of course, smoke is ears, otitis media, and it's also SIDS death. So keep the smoke out of the house. Make sure they have prenatal care, and then why do you think a recent viral illness? You got all that mucus in the nose, right? And it usually a nose full of, mucus. And now they're trying to suck, swallow, breathe, and they got their nose full and they can't breathe. And now they go to bed and they can't breathe because their noses are clogged. Babies are obligatory nose breathers. Clog it up. How are they going to breathe? That's what that's saying. Young mothers, and then young babies, whether they're premature or low birth weight. And males are more apt for SIDS death than females. They say breastfed babies are at less risk for SIDS, that formula fed babies tend to have more SIDS death. Now, reflexes. Moral reflex, that hands up, feet up. This is like a startle, same thing, moral startle. Hit the bed, kid comes up, make a loud noise, kid's hands come up. That's what that is. Take and rub their cheek. This is a rooting reflex. Let me give me that bottle. Oh, let me get that breast. That's what those things are. Those are the two ones you need to know. Step reflex, what do you think that is? You pick them up, and their feet are barely touching the ground, and all of a sudden they're going to try to walk. And that's the step reflex. So those are those things. What's a parachute reflex? Ever take a child and it's somewhere, the middle to the end of infancy, where you take and you put them down into the crib and you put them face down. You'll see them put their hands and feet up like they're going to fall. And if they did fall, you're going to see them. It's like a cat, right? Hands and feet up. It's called a parachute reflex in children. If we don't see that, again, there's a problem. Nutrition. So the first 6 months, we're only going to feed breast milk. We're only going to feed iron fortified formula. And if they can't breastfeed for whatever reason, what would you tell the parents to feed the child? Iron fortified formula, right? First 6 months. Now, after 6 months, they're going to start introducing food. What is the first food that's actually the best? And it's rice cereal. It's the least allergenic. So that's usually what we will start with. And know that with starting the foods, it's one at a time every 4 to 7 days. So that's how we feed the children. Know that breastfed babies should get vitamin D. They don't get enough in the breast milk, and they do need that for good muscle and bone and all of that sort of supplement. One question newborn parents will always ask, especially those that are breastfed, especially if they've been in newborn ICU and we've been giving bottles and we can look at how much numbers of ounces and mLs they've taken, right? Parents become used to that. And then we send them home and tell them to breastfeed. And they're like, well, I don't know how much they took. Well, all you need to say, as long as the baby continues to gain weight, is having 6 to 8 wet diapers with urine and stool, the baby's fine. Okay. And again, let's look at that little fontanelle, and I'll tell parents that. As I said, the second 6 months will start foods. Our biggest concern with giving food is that children have allergies to them. So that's why we're going to wait in between feeding them. What would an allergy look like? It could be a rash, it could be vomiting, diarrhea, abdominal pains. It could be a lot of different something. So, the baby, what he acts like. If you're seeing changes, it could be what that food was, right? You can, at 1 year old, introduce milk, and it needs to be whole milk. Why whole milk? They need the fat. Their central nervous system needs the fat to grow. And then they say soy-based yogurt can be introduced at 6 months instead of a dairy. So that's an interesting concept there. Now, there's a whole bunch of immunizations, and you're like, well, which ones do I need to know? You have a double page in your book. It's like ridiculous the amount, right? So, what do you need to know? First, baby's vaccine is hepatitis B, usually in the hospital. Usually, before they go home, they get their first dose. And again, they're going to have, a couple more doses throughout the year at 2 months, and at 6 months, and at 18 months, somewhere around there. Now, influenza vaccine. We cannot give it till they're 6 months old. The first set of vaccines, did you look at the book? That 2 months, 4 months, 6 months. Was there 4 different injections we have to give? Can you imagine how that could be uncomfortable for the infant? And especially parents like, oh my God, you're going to give them all. It's going to hurt. Well, we can give topical anesthetics. The other thing that is recommended, a nice warm compress, and then bicycle the legs, which means pump them up and down, and it gets that stuff moving, and it will decrease the amount of swelling and the redness in it. And that's what you do with immunizations. The other immunization I think that we look at is varicella, and that's about 15 months. So the couple ones that you need to know. There's your big list of everything. So toddlers. So we talked about pain in your infants. In infants up to age 3, you will use that FLAC scale. Okay. Toddlers, their ages 1 to 3. Guess what? You're going to use the FLAC scale. What else do you use a FLAC scale for? Cognitively delayed children, nonverbal children, children that cannot express themselves well, will be using the FLAC scale, okay? Because they can't point to a picture to tell you how much they hurt. So at birth, we know babies' heads are big, and by about 12, 15 months, head and chest should be about the same. No difference. And nutrition, toddlers. At 12 months, whole milk or fortified soy. And we know the soy yogurt could be at 6 months. What does whole milk do? It gives calcium, potassium, vitamin D, and it helps, with protein needs, okay? Now, vegetables can be given to your toddlers. They're picky eaters. Vegetables are good with fiber and they're good with vitamins, but don't fry them. When you fry your vegetables, all the good stuff is gone. So roast them is what was recommended. Toddlers tend to eat really little. Many of them eat so little they end up with iron deficient anemia and other stuff, that can occur from lack of nutrition. So, looking at these children, we know that the possibility, let's say they do have iron deficient anemia, what would you know would be good food choices? And it's meats, eggs, green vegetables. Those are things you would try to include into the diet to replace it. Remember, any sort of medical condition, um, you have problem with wound healing. What are you going to do? I'm going to give more protein, right? Understanding what food helps with what's going on with the body. Again, approaching the toddler, as I said, get down on them on the floor if you have to. And then again, break open the ice, get on their developmental level. And then you go from least threatening to most threatening. Always, always, always. And you know where I want that child, especially toddlers, to be? In mommy or daddy's arms. Put them on a lap. If any of you ever work at the pediatric hospital here in Miami, I developed a program called Huggies, which is still today at that hospital. And it's H period U period G period. It's an acronym. Help us give great injections efficiently and safely. And what I did research at the hospital was parents who held their child before, during, and after injections and some procedures had less fear and pain and stress, as evidenced by he didn't cry as much. So, Huggies, having parents hold their children, where does a kid feel safe? Where do they feel, less threatened? Put them in a parent's arms. Another thing, don't try to go up and immediately touch them, go quick. Slow down, do it easy, and talk to the kid as you're doing it. Now, how do you know if a kid's not doing well? Are they in pain or are they not feeling well? What are you going to see? Toddlers, it's really easy. When you see a toddler that's not busy exploring the world and they're just sitting there, not doing anything, refusing their favorite foods, something's going on. I mean, if you see them crying and all that stuff, well, that's easy. But when they're not doing what they want to do, they're sitting, they're not playing, not eating, that's when you go and you start, look, is it a fever? And then of course treat the fever and they'll feel better. So FLAC, here we go. FLAC is for ages 0 to 3. At age 3, it will be faces. So if you have a child age 3, it is faces, okay? FLAC is used for those younger kids and for any child nonverbal or cognitively delayed that they can't express themselves. So pain, Yes, we're going to give, whatever pain medicine they want. One of the things you got to remember with giving pain medicine, injections hurt, and kids aren't going to ask for them because they're afraid of injections. I mean, if we could put it in their IV if they had it, I mean, even in the nose is easier than doing any sort of injections. But if we have to, remember, we always have the option of using some sort of anesthetic. They've got all sorts of things. Put ice on it. There's this bee that buzzes. You put it on there and it buzzes the tissue and it doesn't accept pain as well. I mean, there's numbing creams and lotions and jellies. Whatever it is, it all can be used to decrease the pain. Now, as we're doing all those other things, there's that non-pharmacological strategies distraction. Give a kid an iPad, you don't care if he's in pain, right? Give him your phone and they're off to the races. But if they're that kid who's really sick, it might be just be repositioning, might be massaging their back, it might be putting on music. Older kids, they can tolerate hot and cold packs. Younger kids can't tell you if they're too hot or too cold. But older kids, whatever it does to take to distract them, turn on the TV, play some music, play some cards, bring in a game, whatever, it does help. Now, toddlers are in their growth and development. So we're 1 year old and now we're walking. They have tripled their birth weight. They do not quadruple till they're 2.5 years old. So now we've slowed way down. Okay. They are that physiological anorexia. As I said, they're picky, picky, picky. One of the things the book has said is do not give snacks, juice, anything before meal times so that their tummies are empty enough that they'll eat for you. Toddlers between 2 to 3 use both hands. They can start throwing the balls by themselves. Again, parallel play. And we know that at 1, they might be using, one word sentences. And at 2, all of a sudden they're saying more and more and more. Remember, they can speak, but sometimes they can't express themselves completely and they get frustrated. But they're trying these multiple words, sentences, etc. They're trying to dress and feed. They want to do it. Let them try. Potty training. As I said, bowel comes before bladder. Now, the book says it's like 19 to 24 months, but remember, it could be earlier than that. And sometimes it's later than that. All children are different. Potty train is all of a sudden they're starting to feel um, they're having wet their diaper for 2 hours. They're getting control of their urethra. I mean, they do feel their rectum first and that stool. They also we can give them that go to the potty and maybe if they want to please the parents. They could have a older brother that's showing them and they want to show that they can do it. But again, they're trying to please you. As I said, toddlers, they are all over the place, intense environmental exploration. They have temper tantrums. And what do you do with temper tantrums? Well, let them have it, ignore them, unless they're going to hurt themselves or others. I mean, you always want to protect them. Timeouts, 1 minute per year of age. Now, poison control. Why do we need to talk about that with toddlers? Well, how do toddlers explore the world? It's still
Putting
their mouth,
everything in your mouth.
everything in their mouth. I mean, so with that being said, the chances of poison or things that they shouldn't be eating going in their mouth is absolutely, yes, going to happen. So, what do they need to do? What should they be taught? Number one, call poison control. Don't try to make that kid vomit. Don't give him milk. Don't do anything. It takes 2 minutes. Call poison control. They have the most up to date information, and then they can give whatever they need. And of course, they're going to go directly to the hospital or wherever they say. Toddlers, more than any group, need routine. So you get a child that comes into the hospital, a toddler, you need to ask about nap times, bath time, what are foods they like, or any particular activities a day. How does their day come and go? Try to keep the same routine. It gives them comfort, feels good about it. Especially if this kid is autistic. When is their bath time? When is their time that they change their clothes? They don't like change. So again, toddlers, preschoolers, oh, they're still slow. They're growing slow. They're getting more mature. They're being able to speak more. They're still picky eaters, but they're still they're going to eat better than toddlers. The morality, again, moral Goldberg, as I said, when we get up to preschoolers, this is a child that understands good and bad because of punishment and reward. Preschool age children are the age of band-aids. They get a cut, scrape, a boo-boo, and it's bleeding. They're going to bleed to death. Put a band-aid on it, everything's all better. So I mean, I can't even tell you how many types of band-aids are in this house and what brands they are. Because you get a little boo-boo, a little blood, band-aid, and it feels better. One of the things they feel, with like I've said, children go into surgery. Children who've been, with these big cuts, you cover them, put a band-aid, whatever. But always let them know that you're not going to let the doctor put a big band-aid on when he's done so that your insides stay in there. And you think that's silly to say it. These kids understand it. This is what they say. Oh, I think they're going to go in, take my appendix out, and the whole insides are going to come out, and you're going to be all gone. So explaining this is good. Another thing, if they've hurt themselves, many children feel that they've done something bad. They hit the sister yesterday. So there's your Wong's Baker from 0 to 10. This is ages, it's actually 3 to 8, according to your book. It says 6 here, but it's 3 to 8. At 8, it becomes that numeric, okay? So 0 to 3, flack, and you're neurologically, cognitively delayed or nonverbal. And then 3 to 8 is your faces, and then it becomes numeric. So what can a preschooler do now? Oh, look at all the good stuff here. Ride a bike, skip, play ball, walk a line at age 3, a low balance beam, skip or hop, and they're on a bicycle, catch a ball. Ages 4 to 5. Now they're standing on a foot and they're jumping, they're running. One of the things with preschoolers, because now they're more mobile, aren't they? They can walk better, they're less awkward. They tend to be not understanding the environment around them. This is when those motor vehicle accidents where they run over these children. Now, I've told my group, I've seen 3 of them in my career. I've seen one thing happen. I've seen one that was injured, but okay, and I've seen one that died. So, yes, preschool children, there's an increase of injuries, accident-aided, accident-related injuries because they are so mobile now, okay? They're running, chasing balls, riding bicycles in the driveway, and they get run over. Gross motor skills on a 6-year-old. They can ride a bike, they can jump rope, and they can play hopscotch. One of the things that children, and yes, they're more active and they're able to run and be more fast and all that. But the young kids, age 6, are not ready yet for competitive sports. They can't mentally understand it yet. It's too much on them. And then fine motor said,
Is it also because they're not emotionally mature yet, like how say middle schoolers might be?
Oh, yeah, absolutely. I mean, young children, if they can't do things, they get frustrated. Other kids pick on them, and emotionally, it becomes a chore. It doesn't become fun anymore. So you don't introduce them that young. It's better to wait, is what they say. So fine motor, things with the hands. We're buttoning, we're coloring, we're playing, we're threading blocks, bunch of different stuff now. Cutting with scissors, drawing in the lines. Now, preschool is now when we're getting ready to go to school. They do the preschool classes, some children, and some kids, will just start in kindergarten. It's whatever their parents want. But the thing with children and getting ready for school is the parents, the way that they approach it, reading to children at, promoting reading in books and all of those sort of things. It's hard to go from playing all the time and to have to go to school and sit, pay attention. So if there's programs that you could get these kids into that shows that they can work with other kids and pay attention to other adults, it would be a great, great thing for these children. They're getting more and more agile. Their gross and fine motor skills are getting better. And, children are starting to talk, talk, talk. I just liked when Christian started with the word teleportation. Everything was teleporting everywhere. And that was his word they like to use. And it's very common for that age. Common childhood communicable disease. What I want to talk about is chicken pox. Probably you're saying, well, we have a vaccine. Well, they still get it. Problem with chicken pox is that they're infectious when you have nothing to see. The rash hasn't come out yet. So that's the hard part. But chicken pox, and you're a nurse, and let's say you're working urgent care or ER, because this has happened to me many, many, many times. Child comes in, low grade fever, and has a rash with macules and papules that are oozing at all stages of healing. Going to be chickenpox. What do you do? Put an N95 mask on you. Protect yourself. It's airborne. And then get that child in one of those rooms where the air goes outside and not in the hospital so other children get chickenpox. Okay. And then the other question parents has, when can my kid go back to school? All the lesions, every one has to be crusted and dry. Physical abuse, I've mentioned it a little bit already. Just know that if there's any difference between the story of the mother and the child, caregiver child, something's going on. Know that there's physical abuse where they've been hurt, educational, not giving them school, and emotional, those who are always, talking bad to their kid. You're terrible, you're not good, you're whatever. And then, of course, there's sexual abuse that I mentioned, and then emotional. And I think um, that probably is one of the hardest, where the kid's not getting any sort of emotion, at home. Nutrition, nutrition, kids. These are some exact numbers. Okay. Poor eater preschooler, they should have between 1,200 and 1,400 calories a day. Good enough protein, 13 and 19, because muscle health, right? Growth and wound healing, they're always falling down, always have, scabs on their knees and elbows. And of course, calcium for their bones and their teeth. Again, how do you look at nutrition in any age child? What did I eat yesterday? Get a diary. That will always, always be the answer. And then again, diets for children, you can design them according to whatever condition. As I said, if they have iron deficient anemia, give them more green leafy vegetables, eggs, give them meat, right? So we can incorporate that and treat it instead of giving them drugs or whatever. And now school age children. School age children is 6 to 12. It starts with the shedding of the baby teeth till all the final permanent teeth are in the beginning of, puberty. It is a long period of time. They are 6 years old to 12, the way that you treat them, their emotional and physical development are completely different. Now, if you look at the whole 6 years, it's a lot of height, a lot of weight. But again, it's slow. It's very, very slow. Injury prevention. Make sure children wear proper sports gear. Also, again, injury. Whenever you think children, injury, the one that is the most common cause is always a motor vehicle, whether they're in it or they're run over by it. These are those injuries I'm talking about. School-age children who have been this really happy, healthy kid, and all of a sudden are starting to act out. They're not feeling well, or they're starting to be accident prone, something that they weren't before. This could be telling you something's happening at the home. It could be something stressful at home, be a divorce, be they were moving, the dog ran away. Could be, kids will react to whatever. Teaching kids about water safety. This is a great thing, a great community program also. I have a pool in my backyard, but he was afraid. My little Christian at age 2 was doing front flips, no swimmies to the pool. And he knew how to keep himself safe. Now, would he go into the pool alone without asking? Oh, absolutely not. Oh, one time he did it, and my husband ran after him, pulled him out, and he'll never do it again. Pulled him out, brought him in, sat him on his bed, and said, think about it. Don't you ever do that again. And he realized the danger. And we talked about that. One of the things that we don't think about is 13 years old, they should still be in the back seat. They should be in a booster seat till 8. Again, safety equipment. And ATVs. ATVs should never be used by children by themselves, children younger than 16. I mean, sure, the parents can be there watching them, but they're on a ATV. They're gone. And then if they need to take care of themselves, do they have the mental capacity to do that? And then trampolines, they're not good for kids. It's a high rate of injury. Another thing about school-age children is their ages 6 to 12. Make sure that when you're talking to them on a language they understand. Just because they look old does not mean mentally they're there. I mean, I use my grandson as a great example. My second grandson, he's 9. He weighs 145 pounds and he's 5 foot tall. He looks big. But here, he's a 9-year-old. So again, know what you're talking about. Could be a big camera taking a picture. You tell him he's going to have an X-ray. He's going to think stuff's going to come out of his eyes. It's going to shoot in him, and it's going to burn through because he's a superhero. X-rays, right? You got to be careful. ADHD, attention deficit. Can't sit in a place long. Inattentive, hyperactivity, impulsivity, go from this to this to this to this to this. School nurses can help work with them again with these ADHD children. Don't assume parents have done nothing. Again, talk with parents first. Sometimes they just don't know what to do anymore. They've done everything. The kid has no privileges and they're still moving around. It's because they have ADHD. They need maybe some psychological help, maybe meds, but it's something that school nurses can work with the parents. Now, school age, older ones in adolescence, because of that body image thing, because they're understanding life a little more, they can get into these depressions. It could be they lost their best friend, moved away, or the guy that they like doesn't like them anymore, or I mean, kids, what bothers them? It could be any of those things. Now, it is understanding those different changes in behaviors. They're not eating, they're eating too much, sleeping a lot, not sleeping at all, not going out of the house, talking about death, all of those things are giving you signs. Take them seriously. They really will and can have committed suicide. Dental health. Remember losing teeth as a school age child. They're losing all their baby teeth. So that's absolutely normal to lose teeth. Pain in the teeth is absolutely cavities, but losing them doesn't mean that there's something wrong, okay? And they should use, floss before they go to bed. Just remember, first graders, they don't have that dexterity. I've already talked about chicken pox. Here's a picture. It's telling you all the same again. And your goal is again, keep you and everybody else safe. Ray syndrome. This is from aspirin. Um, Children should not be given aspirin routinely. What they say Ray syndrome is you've just had a viral illness. Influenza is the big one. Influenza is a viral illness. They just have it and they get little fevers with it. So you give them aspirin. It could cause Ray syndrome, and it is an extremely life threatening condition. Okay. So never aspirin unless it's ordered by the doctor. In week 5, you're going to learn about disease where we give aspirin. Adolescents, we're almost there, guys. Adolescents, how do you open a conversation with them? Well, you've got to break open the ice, get a little conversation. Because remember, you're older, you are authority, and they may resist you. So, one of the things with them is breaking open the ice. Then you've got parents who have a hard time talking with their kids, right? They're fighting, they're struggling between privileges and responsibility. They want to be able to do what they want, but they need to do the responsibility, whether it's doing good at school or keeping their room clean or all of the above. You're going to see them testing the boundaries because they're going to want to be adults and go out and do what they want when they want. Another thing about adolescents, they're driving now. So increased problem there. Also, they think they're old now because remember, they had that pre adolescent growth spurt. Now they look like adults. So they think they can pick up daddy's gun. And that's when things, guns go off, right? And those are the things that increasing unintentional injuries. It's the cars, it's the guns, and then suicide because body image, they don't like themselves. Nutrition. What do adolescents do? Here's a power bar, bottle of water, and go. They don't eat the way they should, right? And then they're saving the money so they can have it for the weekend. Again, how do you figure out nutrition? Good or bad? Too much, too little? A diary. Find out what they ate yesterday, what they eat for the last week. And then we do have some of those eating disorders. We have anorexia nervosa, which is eating nothing. And then bulimia, eat, purge, vomit. How would you know the difference? If they've been bulimic for a while, you would see rotten teeth because of the stomach acid. So, vaccines, adolescents, it is a 3-shot series for HPV, boys and girls. Okay. Adolescents, as I said, you got to build up their confidential, make them, trust you in whatever way. I've done like, oh, music you're listening to. Oh, you have a sports shirt on. What do you want to be when you grow up? Have you got a school yet? A college? Whatever. Try to make some sort of rapport. And again, have the parents leave the room, and then you could talk a little bit more. Um, I know that I would not talk in front of my mother about sex because she would put me in my room and I would never get out of it again until I was 30. So getting them out of the room, and if it's something that's involved with sexual activity, then the nurse can help me, right? Can I give a teenage girl information about birth control? And the answer is yes. I can give written and oral information, but I can't give my opinion. Teenagers, They are busy trying to do good in schoolwork. They've got a social calendar a mile this long. They've got their phones, they're texting, got a new boyfriend, and they don't sleep. So a lot of sleep deprivation in it. And the thing is, think about it. Preschoolers, the pre-adolescent time, they're gaining 20 to 25% of their height and weight. They need rest, right? Because they're, growing so big, just like the infants, but they don't, and it's just part of being an adolescent.
Professor, I have a
Again,
question.
sure, go ahead.
Do you think that the fact that adolescents now are like into Starbucks and Dunkin' has an effect on, because now it's now a trend that you see middle schoolers, high schools, I'm guilty when I was a high schooler of going to Dunkin' all the time or Starbucks and like getting the venti and the triple shots and whatever. Do you think that plays a factor in the
Absolutely.
sleeping?
Diet, whatever you put. Absolutely. I wasn't allowed to drink coffee as a kid. I mean, again, cultures are different. Remember, I'm involved in the Hispanic culture. My daughter's married to full-blown Cuban. Her father, full-blown Cuban. So it was every morning coffee. And the kids get the milk with a little bit of coffee in it. Like a
Yeah,
leche.
that's how I started off drinking what was left of my grandma's from a very young age.
Exactly.
And next thing you know,
Exactly.
I'm 9 drinking my little coffee in the morning.
Yep, exactly. It's all part of it. And again, you know, we wish that we had a perfect diet, perfect nutrition, but that costs so much money today. People can't afford to eat all of that, natural fruits and vegetables. I mean, we'd be tripling our food allowances, wouldn't we? So again, I've talked about depression, suicide. I think I've mentioned enough. Now, Tanner stage. I did mention this in my class. How do you remember it? And why do I want you to remember it? Couple Hessies ago, Tanner's was on there somehow. And I'm assuming that maybe Tanner's was asking what stage this child was in of development. So, stage one is child, baby, no change. Five is the mature. We know two is the beginning. Females, the first change is breast buds. Males is the enlargement of the scrotum. So the only two that you don't know that you'd have to guess about is three and four. Okay. So it breaks it down that you have a 50-50 chance of where it was. Menstruation starts 2 years after puberty starts. Did you know that? And girls, because now they're in puberty, starting menstruation, they are going through that pre-adolescent growth spurt, 20 to 25% of their height and weight. They become moody, they'll have irregular cycles because of all of this rapid growth and weight. Very, very common for girls. So you've got some dosage calculation videos. Anybody who needs help with dosage calc, make an appointment with me through Canvas. I'll meet any class, RN, PN, in another class that I don't even have, doesn't matter. I will help you. Here's your cahoots. And I think you're all going to do really good. Any questions?